manage and stuff like that. And then effective holistic care. So exercises are also one of the good ways in how mental health physios can use that exercises just to help someone improve their mental health. So how exactly do exercises help basically? So exercise basically it works on the HPA axis and they reduce the production of cortisol. That's how it effectively works. And that's why, the more the exercises, the lower the cortisol levels and the better you are able to manage mental health, stress and everything like that. So yeah, so that's how basically exercises are. Nothing great. There are many other factors. I won't want to describe them in detail, but yeah, this is one of it. Relaxation also helps, definitely. There's mindfulness, there's body awareness, there's yoga, there's Tai Chi. There are so many things over there. Each of them have a unique USP. You can choose whatever you want to choose, and they can also help our patients to relax better. There's Jacobson's technique, there's Alexander's technique. Second year mein main काफी पढ़ा था, but yeah, they are also effective. They are also good. They're also nice. These days you get YouTube guided meditation. So that's something what we can direct our patients to as well if someone comes with mental health problems to us. So yeah, after being an intern in Somaiya, I decided to do a master's. So the master's, my plan was actually loading, and this was my plan, the reason why I did master's, and I'm not apologetic about it. Decided to do master's just to avoid marriage. So yeah, but yeah, I couldn't avoid marriage for a long time. I'm happily married now. Yeah. Okay, going on. So in masters, I decided to explore the aspect of sports. So definitely in sports, there is a more and more, you can, courtesy cricket and stuff like that. You can see there are so many sportsmen having these mental health problems, and which is a bit paradoxical because exercise is supposed to be one of the things which helps people recover from depressions. And suddenly you say sports, people have mental health problems. Where do we stand in that instance? So definitely, this is what MS Dhoni said, that the mental conditioning coach just comes to the Indian cricket team for 15 days. I think it should come for more days because definitely they can help us to manage with the game pressure better and everything like that. So there's a definitely big need of mental health professionals, or as a physiotherapist working in sport, this is something which you need to consider that, okay, if I'm not getting the max out of my sportsman, there's definitely there are things which we can look for and there are things which we can work on with the collaborative efforts of another mental health professional. So a simple case scenario: you are in the ward, you are in your OPD. You are as I said, I'm a master student. I'm working now. Now this patient walks into your room. A runner comes to you with knee pain for treatment. So definitely this is a guy who has knee pain, and then he wants active treatment for it. Yeah. Now he's running a marathon in the next 4 weeks. So Mumbai marathon चार हफ्तों में है. So how is he going to run it? But he's having knee pain. Now this is a question to all of you. I would like most of you to answer this. Would you advise him to continue running or stop running? Please. Simple. Knee pain hai. 4 weeks mein marathon hai. Would you advise him to continue or stop running? Anyone? Assess and decide. Okay, fine. No, but yes, stop running. Okay, would depend on a lot of factors. Yes. Anything else? Continue running. Okay. Continue running. Okay. Reduce pain. Okay. And then extend running. Good. Brilliant. Very good. Excellent. So yeah, you have pretty much all covered it. I need not elaborate that. So definitely. So there are two aspects to any running, rehab in sort of sports. So basically, training and recovery. You have to assess, how are they training and how much time they are spending in recovery as well. So that's important. So assess and decide. That's important. That's very good. too much of either is detrimental. Either too much of running is detrimental, and too much of sort of recovery is also equally detrimental to that. Now, passion is definitely one of the drivers to sports. Definitely people are passionate about sports, and that's why they take sports as well. But however, as from a mental health perspective, just remember there are two aspects of passion. One is a healthy passion in which you are gradually progressing yourself, gradually building it up, and gradually running to a rehab. These are runners with a healthy passion to keep fit, to means in a way they control the running. They are able to sort of take a back step if they are injured and stuff like that. So a healthy passion is okay. But then there are runners, sometimes we get with obsessive passion. So in their case, the running is driving them. If they don't run, oh, I'm gonna lose it. I've applied for this post, I've trained so much, and I'm suddenly, you're telling me to stop. So you have to identify which category your runner fits into as well. So there was a recent paper on this healthy passion and obsessive passion. So that's why I'm sort of elaborating that. If you want to continue them to run, please consider the pain intensity, and the delay the recovery. And as Divya mentioned, I saw Divya's post on that. So slowly and steadily get them to run back slowly and gradually, but don't push yourself. So as if you have that conversation and they take into consideration, that's fine. You are dealing with someone with a healthy passion, and they do consider your perspective. You may have to stop running. Even if you decide to stop running, please consider the impact of retraining, because this is a guy who has trained himself for the last 4 months for an event, and suddenly you're telling him to stop participating. He's not going to take it well. It might impact his mood, and there might be psychological considerations that running is only way in which he escapes everything, and sort of there is a sense of escapism with running. So just be careful, and for that, that's why you have to have an idea about how passionate they are with running, and whether they can stop running so based on the runner you have to make that decision. And I agree with most of the therapists. You all are cued in. That you cannot, one size doesn't fit all, and you have to be flexible. Again, going back to our initial discussion, you have to be flexible in your approach. You cannot just say yes or no. Watch out for female athletes, though. Female athletes, someone has something you have to be very careful about, because obviously there is that female athlete triad syndrome. So definitely low bone mineral density, low energy, and then menstrual issues as well. So if there is a female athlete and who wants to keep on running, there might be chances, and then there might be underlying eating disorders and stuff like that from a psychological perspective. Poor body image perception. I want to look fit like Deepika or someone like that. So watch out for that. They are serious psychological issues, and I've seen many people starve themselves to death. Models, high performing athletes, high performing models. So just watch out for that. Female athletes, you have to be aware of this aspect of management as well. So yeah, just a few tips. Obviously, a thorough history is important. Assess their physical, mental, and patient goals. Assess what they can do, what they can't do, and what they're expecting to achieve. Menstrual history is very important if it's a female athlete. Regularity of menstrual cycles and stuff like that. And you have to be, even as male therapist. I just ask them. But I have a better way of asking them. I also say that this. You may think that this is not relevant, but this is something I have to ask you. Question: are you comfortable with answering that question? And once they say yes, then as a male therapist, I ask that question. That just works for me. But you have to ask it if it's a female athlete. Evaluate the habit, diet, training plan, everything. You have to evaluate it thoroughly. Modify the load. Obviously, get them to running slowly and steadily, and then increase it. Strength and conditioning has another important aspect in that, other than your mental and psychological side. And then emphasis on recovery is important. And again, it's teamwork. If there's something you cannot manage, if it's a female athlete triad syndrome, if you feel they need to see a psychologist, please feel free to refer on, because you cannot do everything. Exactly, that's what I meant. So obviously, if you wish to explore this topic more, there's me and my friend Rohan. We do run, sort of workshops and stuff like that. So you can get in touch with him. Definitely we do a collaborative effort. and we do explain all these things in detail. And now if we get a decent number, that's something what we can explore in the near future. So yeah, my friend Rohan, he's my colleague, and yeah, we do tend to work together on this thing. So yeah, final topic. I have bored you enough. So this is the final topic, believe me, but this is equally important to be all a therapist, and we cannot ignore that. Given the fact that what happened yesterday, I need not explain you what happened yesterday. So yeah, we have to be Atmanirbhar as a therapist. We have to, you know, Atmanirbhar is very important thing, what has been explained. Self-care is very, very important for our therapist, for us as therapists. Because if you are empty, you cannot fill others. If you yourself are trained, if you yourself are low battery, you cannot motivate, you cannot push, you cannot do counseling for other patients. So just be remember of that. If you are full of everything, if you're full exploding and everything, then only you can share your ideas and everything. I don't know who wrote this, but I read it on Facebook. Looked good. So yeah, that's why I shared it. So don't ask me where I found this quote. So yeah, but it made sense to me. So yeah. Burnout in physiotherapists, this is a serious topic. Nobody tells us, nobody talks about it. And this is suddenly picking up press now these days. So burnout is a serious condition in physiotherapists. Yeah. High personal expectations in physiotherapists is the biggest reasons. Okay, I will treat all my patients. I am going to make everyone better. I'm going to make everyone happy. Everyone who comes to my clinic is going to walk, is going to run, is going to swim, is going to smash all the world records, is going to be the next Virat Kohli. That's high expectations. So high expectations is number one leading cause of burnout in many physiotherapists. Dealing with patients with chronic complaints. If a patient comes to you, repeatedly for the same problem, you tend to think, oh, did I do this? Did I do that? And then you treat them, you go home, yet you think, okay, did I do this wrong? Did I do that wrong? And then even at home, despite you are sitting and watching a movie, you're still reflecting on that patient. So that is also important thing, especially for chronic pain patients whom we cannot help beyond a point. So it's necessary to identify that as well, who we can help and who we sort of cannot help after a point in time, definitely. Emotional exhaustion, physiotherapy is physically and emotionally, it is an exhausting job. If you see 20 patients on a day repeatedly over a long period of time, definitely it is going to take an emotional toll on you. Everyone expects you that, okay, physiotherapist is supposed to be strong. You are a medical professional. You shouldn't take money. You should be selfless. You should leave your movies. You should leave your friends and everything and only serve patients. That is a loss of emotional exhaustion. So just be aware of that. Depression is also unfortunately very common in normal people these days. Many healthcare professionals have it. So physiotherapists are not immune to that. So this is something to consider as well. Younger age, the more younger you are, the more likely you are going to be burnt out as a physiotherapist. With age, you know how to manage things, but more younger you are, unfortunately, young physios are more susceptible to sort of burnout rather than more experienced and sort of more mature physiotherapists. Females, I don't know, for some strange reason in India, this is an Indian study what I'm discussing. Female physios are more exposed, or this is not physio, sorry, this is just healthcare professionals. Female healthcare professionals are more exposed to burnout, more prone to burnout than male professionals. I don't know why. Now, this can be multifactorial if you look at the society, if you look at everything, and then the work-life balance, marriage, postnatal depression. There's so many factors, but female, unfortunately, are more prone to have burnout than men. Unmarried, if you're not married, there's no sort of support, if you're living on your own, you're more likely to have a burnout than as compared to if you're in married or if you're in a serious relationship or anything like that, according to research. And difficult work conditions as well. Difficult work conditions if you're seeing too many patients in a day. So this was a research done in Rajasthan by K Sarwani et al. They have sort of analyzed, it's a systematic review on the medicos, basically healthcare professionals. They have taken physios in this in their group as well. So they haven't excluded physios. So yeah, this was the finding. So the one in the red is just it's a European study. It's a European study, whereas the other one, this is an Indian study. So unfortunately, burnout is very common in physiotherapists. So and we cannot escape from that fact. So yeah, this is my bet. Spot me if you can. This were interestingly, after what happened yesterday, the reason why I shared this picture was after what happened yesterday, Sushant Singh Rajput I'm talking about. We all, we have a WhatsApp group and we tried to discuss, okay, is this a serious problem or not? Surprisingly or not, 70% of, not all, I won't take their names, but definitely 70% of therapists did have some stress related. These are physios with 10 years of experience, roughly 10 years. When yeah, it is 10 years. Yeah, 2010. It's when we qualified. These are physios with 10 years. There's also research which says that the more experienced you are, the more number of patients you see. So there's a flip side to this. When you are young, you are also prone to burnout. More experienced you are, you're also equally prone to burnout. So just watch out for that as well. And many therapists out of these lot did have mental health problems at some point in their time. They did feel suicidal. And this was something nobody had shared until yesterday. And yesterday we all got together and we were like, yeah, someone did this, someone did that. And just an honest confession, I was the unfortunate one who had mental health problems and suicidal thoughts in my second year in physiotherapy. And that's how I have explored this topic. And that's how I can vouch for it. It is a serious thing. It's not easy. My reasoning was that I came from non-physio background, non-medical background. Suddenly, this intelligent guy expecting a lot. I decided to push myself a lot, become scared, pushing myself, failing in a few subjects, even though I was supposed to be the brightest one. So yeah, but I've suffered from it. I'm not disputing that. So it is an important thing. Burnout, physio burnout. It is a serious thing. Nobody talks about it. We are not aware. And I was actually surprised that majority of my friends, these are my friends, these are my colleagues, they also have experienced burnout at a certain point in your life. So yeah, productive work. Most people think, if you are working productively, most people think, if you are a productive physio, the ideal structure, most people think that you should have leisure equally along with social media exposure and work. So they both should be equal in your sort of in your day. This is the time you spend daily on a regular basis. So you should have a balance about your work, your leisure, as well as social media. But however, the best way how you can engage, you can be more productive according to me. This is again my perspective. I'm not a motivational guru or anything like that. This is just coming from a healthcare professional who has been in depression, who has discovered ways, who has tried and different aspects, and this is something what worked for me. So definitely work is important, but definitely there is a place for leisure. There is a place for reading. Reading may be physio, may not be physio. Exercise, again, we tell our patients to exercise. How many times do we exercise? And I'm guilty. I'm equally guilty of it. I didn't exercise much. So, and that's fine. Planning and reflection is also one thing. You have to be, important. You have to reflect. You have to plan. And there are days when you fail as a physiotherapist, and you should be comfortable with it because you are not going to treat everyone, unfortunately. There are some patients you are going to fail, and that's okay. That's fine. This is life. Social media exposure is also one of the important things. Social media, they these days it's difficult to keep yourself off your phone even for a few seconds, and that's really making us, not helping us to solve our mental demons, our mental problems. It's not giving us time to plan and reflect, and it's just putting us on a loop of, just consumption, consumption, consumption. And but we need to isolate ourselves from social media effectively as well. That's also equally effective. So just be aware of these things as well. How to refill yourself? Again, my take on it: exercise daily. Try and have an exercise. Try and do something productive, something exercise. Suppress your cortisol level. As I explained before. Nothing what we physio know or don't know, but it's important to remind ourselves sometimes. Meditate regularly as far as possible. Just meditate. Now, these are just not my guidelines. I discussed this with my group yesterday, and most of them said yes to most of these things as well. So have a routine. So plan your work, basically work, play, plan. With these many times I'm going to see the social media. These many times I'm going to respond to emails. This that helps. That really helps. It sounds that you are going to be caged or sort of structured in a routine, but it's not exactly. It actually liberates you further. So, but plan it, but don't be rigid about it. So there is that flip side as well. So just be aware of that. Express and write your negative thought. Reflection does help. Writing a diary, writing a book definitely does help. It helps to calm down your demons. It helps you to, helps you to understand your limitations as a therapist. You cannot solve all the world problems, and it will take time to solve certain problems, and it will take time to upgrade yourself. So just be comfortable with those ideas. Exposure following after 7 p.m. So just before I sleep, I try to isolate. I try. It's not sort of complete 100%, but I try as much as possible to restrict my time on social media or phone exposure. Definitely, because there's research which says that phone, if you look at the phone consistently, and definitely it sort of stimulates your melatonin and disturbs your sleep wake cycle. So yeah, it is important to consider that after 7 o'clock. Seek help if required. 2 times I have approached the psychiatrist. Twice I have been on medication, and that's just my experience. And being a man who's, you are supposed to be mat ko dard nahi hota hai, but you have to be sometimes in touch with your human side and just seek help if required. There's no shame in asking for help. Easier said than done, though. I will tell you, it's not easy, but seek help. That's the best thing what you can do. This is just my perspective, mind you. This is just my formulaic way of looking at things. Yeah. And it has been confirmed by my friends. No one size fits all. Explore your strategy. That's what I would say. This is a structure. This is a Google map finding. See, if you are at Somaiya and you want to get at Andheri, the fastest way how Google map is going to get you there is either via a train or a bus. It's your intention to catch which train you want to plan which train you want to catch, or do you want to catch a bus, or if you have more money you can either take an Ola. So yeah, it's your plan. So you decide how you want to go from here to here, from Sion to Andheri. There are different routes, so these are the different routes, but you have to find which is good for you, and it comes with trial and error. Be kind on yourself, take your time, and then go ahead with it. So definitely the conclusion is that physiotherapy, it is clinically very cost-effective intervention. It does help to promote activity, preserve and promote activity in people. You always have to have an open mind and look out for things which you may miss. So just be aware of that. And first and foremost, before going on to mental health, please, as a physiotherapist, look at all the physical avenues. Once you exhaust that, then think about mental health. So if there's a patient who comes to you, you have to try all your electromodalities, you have to try your exercises, you have to try everything, at least for a period of 6 months to 8 months, before labeling someone having a mental health problem or a mental health pain, and which you cannot manage, and then you have to refer it on. Directly don't refer on day one, because that's not feasible. You have to give physiotherapy, your profession, a chance to treat the pain before referring on. So that's definitely one thing I would tell you. My take on it is, it's still a very new field. There's still a lot to learn. There are more questions rather than answers in this. There are many existing beliefs which need to be shattered and challenged. So therefore, I would suggest, please keep upgrading. So this is how I look at things. The journey has just begun. So you have just started this journey. Let's see where we go. Exciting times, exciting few more years ahead us, and you might have to keep on upgrading yourself. So yeah, this is where we are. All right then, any questions? I just have some water if you don't mind. Can I stop sharing if that's okay?
Yeah, that's fine.
Okay, that's fine.
Few questions I will read out for
that's
you.
Fine. Yeah, can you please one at a time, if that's okay? Yes, yeah.
So I'm Dr. Riddhi, and I would read out the questions which are there in the chat box for you. So
Please,
the
Dr.
first one
Riddhi.
is, how to keep sane in this lockdown. So the question is asked by, I think, Divya, because I can just see the icons. So yeah, and also I frequently find myself thinking about negative thoughts. So how can I keep myself sane in this lockdown? So yeah.
I'll be honest, this is a challenging time for us, for you, you, for everyone. There's uncertainty over there. There you are suddenly losing your will to get out there, because we physios, we are very hands-on people. We like to manage, we like to manipulate. And then then we also have our clinics to run. We also have our bills to pay. We also have everything to do. And I'll be honest with you, it is a challenging time at this point in time, challenging thing to do at this point in time. My honest answer to that is, see, I'm not a motivational speaker. I'm not a motivational guru. As I said, I gave you some tips over there which can help. Reflection is, one thing which definitely helps. Exercise, definitely at home, doing yoga, meditation, are few ways. And definitely, if you have any hobby, I'll tell you how I dealt with my negative thoughts or negativity. First and foremost, have a routine, have a structure. Okay, I have to get up at this time. I have to get dress up. I have to get ready as if I'm going to work. Yeah, and then sit and do work. What you can do at home. Now, what's work for me at home? These I have used this time just to learn a lot about physiotherapy research, learn a lot about physiotherapy knowledge, and I'm a painter as well. I like to make. So I decided to learn something new. I decided to learn animation. I'm like, I love teaching. How can I make use of the animation strategies to teach a larger candidate? And in that sense, in that way, I can build up my online profile, so that even when I'm not there face to face, at least people can learn from my experiences. At least people can learn from my perspectives. That's how I took it. People think it's a negative thing. I saw that as an opportunity. Okay, fine. Okay, I have a lot of time. Let me build my online profile. Let me do some painting. My wife, she is doing work from home. I do the cooking at home. I love cooking. That's fine. I cut vegetables. I do everything. I'm trying to be creative. I'm a creative person. I like to explore my creativity. I like to use it. So I'm finding avenues or finding ways where I can be creative. I go to the kitchen, I cook, I go do something else. And definitely exposure to social media is something you have to be careful about, because everywhere you see, social media, I've seen many people, doing exercises, doing everything, looking fit, looking great. And it makes you feel, okay, I'm absolute rubbish. I am absolutely the worst person in this world. I've got fat here. I've got this here, my cheeks, I've got a double chin. All these things are bound to happen. But at the end of the day, you have to ask yourself what's important to you. What do you like? What do you dislike? You have to come up with that. Work on what you like and just ignore the dislikes. You are not going to. Social media has made things worse for us, actually, in that sense, because in the good old days, I'm talking about the 10th. 10th ka marks jab aate the na, the worst I used to get compared is what with my mama ka someone who got 85%, and you are no good. So, but now these days there's so much exposure, so much. Everyone's getting 95, everyone's getting 93, everyone's getting 98, everyone's getting 100. So that makes sometimes things worse. But you should control, again, like running, like an obsessive runner. The social media shouldn't control you. You should control it. You are like, fine, ठीक है, उसको मिला ना 98%, वो great है. अच्छा, उसका वरुण धवन का body great है ना, अच्छा, वो great है. But I'm also equally great. I'm a good physio. I can do what I can control. You cannot do what you cannot control. So understand what you can control and what you can't control. And if there are negative thoughts, again, meditation helps. There are loads of motivational gurus, listens to speeches. Sometimes that helps. And just do something creative. Just get creative if you're creative. That's what I would say.
So
Hello,
yes,
sir. Myself,
Yes.
Natasha Tungare. So I have a question that many a times, as in this is what happens with me, that as
Yes.
a physiotherapist, we are much more connected to the patient. So
Yes.
we patient tend to share many of their stories, their issues with us. They feel free to talk to us. And this is what happens with me, that when I listen to their sad stories or when I listen to their emotions, for that moment I'm fine, but then later on even I start feeling down. And my question is that how to set our own mental health boundaries so that we don't get affected by others' emotions. I mean, even if that person is not closely related to us, it does happen that we do feel really bad for that few days by listening to them. So, how to set our own boundaries?
Very good question. I absolutely loved it, Natasha. Thank you very much. I'll tell you my take on it, because this is the exact thing used to happen to me. The reason why I have been depressed or, taking anti-anxiety medications. Yeah, I absolutely agree with you. This is a normal thing because at the end of the day, we all are humans. We like to help other people. We want to make sure that, you have to help people, you have to make them feel better, and at that point in time, we are very objective. But when we go home, we tend to reflect, oh, poor person, they're doing a lot. They're doing these things. They're doing that things. Still, it's not helping you. Them still, things are not great as they are, and that's normal. That's okay. Everyone deals through it. I have a way to work through that. What I tend to do is after my day, hard days at work, I come home and I meditate just for 10 minutes. Yeah. And in that meditation, all these negative thoughts come to me. Yeah. I acknowledge them. That's fine. That's okay. I am human. I am going to feel that way. Sometimes during that meditation, I do tend to cry as well sometimes.
Yes.
I feel sorry about people. That's okay. Crying is healthy because you are expressing an emotion. Yeah. If I can deal with that emotion there and there in that half minute of meditation, that's great. That helps me. That's fine. That's matter solved. Sometimes even that doesn't help me. In that case, I just take my diary and I just write all the notes. वो जब भी मैं देखिए, उसकी उसका नाम लिखो और उसको जला दो. That helps. Sound silly, या फिर नाम लिखो या फिर जो भी emotions आते हैं, you just put it on a piece of paper and just
Correct.
tear it, and that helps. Sometimes it helps. So, and then again, if there is a stage where you feel you cannot manage it, just talk to someone, talk to another therapist, talk to one of your professors or someone who's very experienced. They know how to deal with it. And this, if they are, if and I'm sure, many professors in Somaiya did help me a lot during my depression. So I don't see any reason why they shouldn't help you or why they should lie at you. That's normal. That's okay. We are humans. We are caring people. That's why we are physios. That is a good thing to have, but learn to manage it. You have to learn to manage it. Otherwise, this stress and burnouts are common. So yeah, just have to manage it. That's normal.
Yes. So thank you
Next,
so much, sir.
no problem. Next question. Anyone? There was one question typed here. Sorry.
Yes. So it
Uh,
says that you said to follow all physical therapy options before
yes.
giving a
Yes.
reference before mental issues. So will the
Yeah.
patient be benefited to refer in the beginning itself if the person is facing mental disorders?
Yeah, this is by Anna ma'am. Anna ma'am, obviously, ma'am, you are experienced. There are times when you can easily spot all these issues, and you can directly refer. That's okay. That's fine as well. But what I said in that what the context which I said that was that don't just label patients that he is having a mental aspect of pain. Labeling is something what I was against. That's why I said exhaust all your bullets of physiotherapy. Yeah, if it's a straightforward person you can see and he definitely needs counseling, they are not in a good mood, yes, refer on. I am all for it. But if there's no sort of facial expression, if there's nothing what you can talk about or nothing which you can spot, by all means, then you have to use your physio bullets first before referring on further. So yeah, if you can pick, yeah, go on, go ahead. I'm not saying, oh, physio first, then only push off. No, there are times in which patient ko dekh ke hi pata chalta hai that, yeah, this guy needs help. In that case, please, please, please go ahead, refer on. And the worst thing is it's good to refer on because zyada se zyada kya hoga, worst thing is that you may be wrong, and that's fine. That's all a part of learning experience. That's okay. It's okay to make mistakes rather than not referring on forwards. It's okay to over refer a patient to a psychiatric health than to be dealing with the guilt that I didn't refer this guy and that guy ended up committing suicide. So refer on. It's okay to be wrong. That's fine. That's human. We learn from our mistakes.
Thank you, Omkar. I understand that is because we have seen this happen sometimes. Patients do
Yeah.
not want to understand it. Though we refer,
Yes.
sometimes they don't even go to the department.
That's fine. You have done the best. That's the best what you can do. If they don't wish to be helped, leave them. It's their choice. You can't push them. You can't force them.
Yeah, thank you very much.
No problem, ma'am.